Joining us is Dr. Don Kakawa from UCSD Shiley Eye Center, who performed Sybil's eye operation to fix her protruding eyes. Thank you, sir, for being here.
Thank you for having me.
So other than Sybil, who is the right candidate for this type of surgery?
Well, years ago when this operation was described, it was considered very risky, as I'm sure you can understand that. And many patients were told, don't do anything, live with the condition. But in certain cases, patients that are severely disfigured, they don't look like themselves, they have shunned activity within their social circle because they can't go out. Another reason would be the pain and pressure that people feel from the eyes bulging out.
So it is twofold. It's cosmetic, obviously, with that bulging look, but also there are symptoms with all that buildup of pressure, extra tissue, and back of the globe.
Right. The tissue buildup here occurs in the muscles and the soft tissue. It pushes the eye out. So yes, that does cause discomfort.
People need to know this at home. Your eye bulging is just one of the symptoms of Graves' disease. Other symptoms you might have: anxiety, irritability, a difficult time sleeping, a lot of times an irregular and rapid heartbeat, as well as increased perspiration, and then the protruding eyes that we're talking about.
Right, we know that we don't know exactly why, but that extra thyroid hormone circulating in the body has a direct effect on the eyes, and I want you to check this out, exactly what's going on. The thyroid gland, the so-called master gland, is producing too much thyroid hormone, and it has a direct effect, as you said, on the soft tissue structures in and around the globe. It causes the muscle soft tissue structures to enlarge, and in turn, that bulging look.
The actual cause is thought to be the immune system nowadays. And it's kind of called a thyroid eye disease, but it's somewhat of a misnomer. The immune system independently attacks the thyroid gland and the eyes and causes the eyes to bulge.
So people, in that model there, literally the eye
bulges out. And some people have the thyroid gland removed, but yet the eyes can still have problems. So we know it's the immune system that's doing the underlying problem.
Sybil had this surgery with Dr. Kakawa just 5 weeks ago. She's already had some improvement in her eyes. Everyone excited to see Sybil's new results?
Yes!
All right, let's meet her. Come on out, Sybil.
Welcome. You know this guy.
Hi.
Nice work. Have a seat right here.
So I want everyone once again to look at you before, and let's compare to now, after the surgery.
Wow. Big difference. And how are you feeling?
Great. It's just wonderful. I don't have any more pressure behind my eyes. I don't feel I have to use effort to keep my eyes closed. I can just relax. What's also very nice is I don't have kids pointing at me and telling me I have,
Bug eyes.
Yes.
Well, your eyes is one, everyone talks about the smile, but the eyes are the other thing that you look at the first time when you greet someone. And if I were to look at you right now, I would never know that you had suffered with Graves' disease. I do want people at home to know that there are certain situations where you need to pay attention. Family history of Graves' disease. Women are 7 times more likely to get this disease if you smoke, depending upon your age. That certainly can be a risk factor. So you've got to pay attention to those potential risk factors. If there does become a scenario where you suffer from Graves' disease, but maybe you're not ready for surgery, what steps can people take at home to deal with this?
Yeah, unfortunately, there isn't a whole lot. We want to protect the eyes, make sure they're moist. Oftentimes, we encourage the cessation of smoking. That seems to be very highly correlated with the worsening of disease. We ask them to use artificial tears to lubricate the eye, elevate the head of the bed, use ice packs, but more importantly, just check with your ophthalmologist and just make sure you're not developing the life-threatening, vision-threatening problems that you can get with this problem. And one thing about the gender predisposition, women are more prone to getting it, but when men get it, they usually get it worse than women. So that's important to know.
So certainly something that can affect all of us. Thank you, Dr. Kakawa. Thank you so much for
Thank you.
joining us. You look fantastic.